What do you do in the first stage of labor to a patient? What are the things that you need to do? First, you need to do the examination of the patient. Then after that, what are we going to read in today's class is normal mechanism of labor. Third, I'll be telling you about the clinical course of normal labor. Fourth, we are going to read about the fetal heart rate surveillance in labor, that is intrapartum fetal heart surveillance. Although this we have a separate class altogether because NST CTG is the most important topic. But today also I'll be giving you a brief coverage about it. Then we will talk about IOL, which is induction of labor. Then we will see a little about labor dystocia. And lastly, I will be talking about abnormalities of first stage of labor and little bit about its management. Now coming to examination. First, let us see about examination. In examination, you do an abdominal palpation and obviously inspection, like inspection comes here first. Abdominal inspection and palpation. In palpation comes the Leopold maneuver. What are the outcomes? What are the things you are going to derive from a per abdomen examination of a patient presenting to you in labor? First, ask yourself these 9 questions that I'm going to write down. Take note of these questions. This has to be there in your clinical notes whenever you are mentioning examination of a patient. Is the lie longitudinal, transverse, or oblique? This is the first thing that you have to check while you are examining your patient, and keep this in your mind. Next is what presents at or in the pelvic inlet, which is the presenting part. Third question you have to know is where is the back? So all these things are going to come out of Leopold's maneuver. Next, check where are the small parts. Next, check what is in the uterine fundus. On which side is the cephalic prominence? Check for cephalic prominence. 7th, has engagement. आप एक examination के साथ you have to answer all of these questions in the same sequence of order. Has engagement taken place? How high in the abdomen is the uterine fundus? Sometimes clinically when we examine the fundus, हमें लगेगा कि IUGR patient है, IUGR baby is in labor, but we fail to realize कि head इतना नीचे pelvis में गया हुआ है. Station अगर 0 पे होगा तो obviously there will be a descent of fundus. You should not confuse it with an IUGR labor. Very, very important is how big is the baby clinically. So these are the things which you should be able to answer for yourself when you're doing an abdominal inspection and palpation.